Tonight we are learning vaccine distribution in Mobile and Baldwin counties has hit a dangerous bottleneck.
Due to a lack of supply, many healthcare providers in our area are no longer providing vaccine appointments to the general public.
NBC 15's Corey Pippin joins us now. Corey, our local health officials are pointing the blame at the federal level.
Well, Greg, Kim, the Mobile County Health Department and many local hospitals are only providing appointments for second dose vaccinations, and others have stopped appointments altogether.
Tonight, local healthcare workers continue the uphill battle to save lives while COVID-19 rates threaten to overwhelm hospitals. Meanwhile, the prime weapon in the fight against the spread of the virus is drying up.
The protocols in the place and the people are there to deliver the vaccine, but the vaccine product is really the obstacle right now.
Dr. Scott Chavers with the Mobile County Health Department says they're no longer able to provide first dose vaccinations to the first group eligible to receive them: people 75 and older, healthcare workers, and first responders.
Where it gets frustrating is that we can vaccinate, if we are fully staffed, 650 individuals an hour if we had product. Now, we couldn't sustain that model, but we're at the very end of the line.
First dose appointments are also on hold at Infirmary Health, Providence Hospital, and the South Baldwin Regional Medical Center. And USA Health only offers vaccinations to patients if they're already in the system. State Health Officer Dr. Scott Harris says since Alabama makes up 1.4% of the country's population, the state only receives 1.4% of vaccine available from the federal government.
We are trying to get the vaccine out as quickly as we possibly can. Our current priority groups, that represents between 650 and 700,000 people. And we're only getting 50,000 or perhaps sometimes 60,000 doses per week.
Spring Hill Hospital will start taking applications for appointments again tomorrow, but it's unknown when those doses will be given out.
All the doses that are remaining have been assigned to someone, either as a second dose or as a primary dose for someone who hasn't come in for their appointment yet. So there are not large amounts of unused vaccine sitting around.
Dr. Harris says it's important to note that everyone in the current priority group needs 2 shots. That means the state needs at least 1.4 million doses of the vaccine to cover that entire population. Greg, Kim?